Okay, welcome everybody to episode 2 of Provider Pearls. Today we are very pleased to be joined by Dr. Dustin Portela of Treasure Valley Dermatology. Cheers for jumping on, Dustin.
Hey, thanks, Pete.
Really briefly, so we do these Provider Pearls just as a really off-the-cuff way of just getting feedback from our current users. So we'll keep this quick, and we'll keep it casual. Wanted to ask you probably 2 questions. First question for you, from a dermatologist standpoint, in Boise, Idaho, what made you invest in Swift?
Swift looked like a good opportunity as it started to come out. I'm kind of a junkie for new technology, and I like to kind of have the latest and the greatest thing. And so as I was looking at this new device coming out, I was a little bit skeptical because it was something that was a cash pay treatment for warts, a service that we typically get covered pretty well. But I was intrigued about the immune stimulating mechanism, because that's really what we're trying to get with all of the treatments that we use. But it's really difficult to achieve. And most of the treatments were pretty painful for my patients, and the success rates were so variable. And so, the ability to use a new modality that the data that had been published on it were a lot higher, kind of satisfied for me that I could provide something I would be confident about for my patients. And also seeing these patients come back time and time again, spending a lot of money with their high deductibles, and they're limping out of my office, or we're trying to time their treatments around sports activities and exercise and competition. It just became a decision where I knew that my patients really wouldn't be paying a lot different, but we'd be offering them a treatment that was likely to be more effective and that would have less downtime for them. So kind of multiple factors that worked into the decision. It was attractive for me to be kind of early to the game in my area, where I could offer a unique service. As a young practice, at less than 2 years open, I wanted to find a way to draw more patients into my practice, and Swift has been effective for that.
Perfect. And just as a follow-up, how has it lived up to your expectations? What's the experience been so far for you?
We've been really happy with it so far. The majority of patients that we've treated have responded as you would expect. Within 3 to 4 treatments, we're seeing significant improvement or total clearance of the warts. The one that stands out the most to me is a gentleman who drove from out of state to see us, who had been through every treatment that you could throw at him, had warts on his foot so painful he had actually been to physical therapy because he'd injured his opposite knee because he was walking funny. And after coming out, he was driving during COVID and everything, and we were able to treat him and take these warts that he dealt with for almost a decade and make him go away in 4 treatments. And he was the happiest patient that I've ever seen walk out of my office when we finished.
That's fantastic. Awesome. We love to hear those stories and it maybe plays nicely into the frustration element of this condition. In speaking to a lot of your peers, the general sentiment is, it's just, Chris, it's just a tough condition to treat. And, beyond, scratching, warts are probably the second toughest condition for us to treat. Can you comment on the frustration element of treating warts, specifically from a provider standpoint, but also maybe echo the patient's frustration side of things, if you could?
Yeah, from my standpoint, I try to be, cognizant of the fact that patients are paying for my services, and most everybody has a high deductible plan now. And sometimes these young, healthy patients, warts are their only problem. They're unlikely to meet their deductible due to other medical problems. And so they are paying a lot of money, or their parents are paying a lot of money to get these warts treated. And if we have to treat them 6, 8, 10 times, that really adds up for a patient. And so it's frustrating for me because I'm trying to deliver a treatment that I'm not really meeting their end goal very quickly. Mm-hmm. And then from a patient perspective, we go through a lot of treatments. Most of them have tried over-the-counter remedies before they've come in. They're freezing them with the over-the-counter options. They're putting, salicylic acid on it from over-the-counter. And so they've been through lots of treatments. Most of them have been painful. Sometimes, like I mentioned before, they get a treatment and then they have to miss basketball practice or football practice or dance practice for several days because they're limping with blisters or wounds from surgery. So being able to offer something that is getting rid of the warts quicker has been satisfying for me. And we're able to get the patients, back into their normal activities quicker. They don't have downtime after the treatment, and the warts are going away. They're happy.
Yeah, fantastic. And what would you say your level of acceptance has been if you had to put a percentage to it and you offered Swift as an option? What would you say your acceptance level has been?
We're probably around the 40%, if I just had to guess off the top of my head. There's certain patient populations that are unlikely to go for it if they have government insurance where they're not paying a copay anyway, regardless of what we do. It's usually not something they want to pay out of pocket for unless they've really just exhausted all of the other options. And with that being said, I've had patients who have been on Medicaid or Medicare in a secondary who have been frustrated with the traditional options, even though they were covered well, and they choose to pay out of pocket for them. And so that's something that some people will choose to do. For the commercially insured patients with a high deductible, we're seeing a lot of them choose it because of the lack of downtime, and they've usually gone through those over-the-counter treatments as well. And maybe they've gone through several treatments with us. I do make every patient aware of Swift as an option right from the get-go. And I think they get thinking about it. And if we're not seeing progress quickly, they like to jump into it. So the initial conversion rate might be about 40%, but I think we pick up some as we go on some of the other treatments as well.
Yeah, that's certainly what we're seeing in the community. What we typically see, especially if there's a naive situation where a patient may potentially want to try a conventional reimbursed modality or insurance covered modality. They oftentimes, if they don't have a great result, which happens, they'll come back and say, "Hey, what was that Swift device all about?" Or can you tell me a little bit more about it? So we do see that end of it as well.
Almost becomes a retention tool, as well as a new patient attraction tool.
Mm-hmm.
A lot of dermatologists we speak to refer to warts as the ego killer.
Yeah, they certainly can do that.
Well, listen, really appreciate the time today. We'll end it there, but really appreciate the commitment to Swift and to the community. You're doing a great thing up there, and if there's anything we can do to help you out, just let us know.
Hey, thanks, Pete. Thanks,
all right.
Chris.
Thank you.
Thanks so much. Take care.
Bye-bye.
Bye.